Welcome to Wise and Wild of America, a series meant to inspire and empower you on your self-discovery and self-authorship journey. I am Adina Dabija, and I had the honor to host here last week Dr. Pamela Smith, with whom I had a very interesting conversation on various health topics, such as hormonal balance, autoimmune dysfunction, breast health, mood disorders in teenagers, and also her personal journey from an emergency room doctor to a functional personalized medicine doctor, teacher, and author. In fact, I had the privilege to know Dr. Smith through her teachings and books. Dr. Pamela Wartian Smith spent her first 20 years of practice as an emergency room physician in a level 1 trauma center with the Detroit Medical Center, and then 29 years as a functional or personalized medicine specialist. She is an internationally known speaker and author. She also holds a master's degree in public health, along with a master's degree in metabolic and nutritional medicine. Dr. Smith is in private practice and is the senior partner for the Center for Precision Medicine, with offices in Michigan and Florida. She has been featured on CNN, PBS, and many other television networks, and has hosted two of her own radio shows. Dr. Smith was one of the featured physicians on the PBS series, The Embrace of Aging, as well as the online medical series Awakening from Alzheimer's and Regain Your Brain. Dr. Pamela Smith is the co-director of the Personalized Medicine Certification at the Morsani College of Medicine, University of South Florida. She is the author of 14 best-selling books. Her book, What You Must Know About Women's Hormones, second edition, was released in 2022. Her book, Maximize Your Male Hormones, was released in 2023. And her book, What You Must Know About Thyroid Disorders, second edition, was released late last year. Her newest book, How to Prevent Breast Cancer Before and After, is due out this fall. So, as a student of Dr. Smith, I found her approach very useful in my personal practice, especially when it comes to immune regulation and hormonal health. So here is the first question I had for Dr. Smith last week. What exactly is functional medicine, and what are some of the roadblocks preventing it from becoming mainstream in this day and age?
Honestly, my goal is to help it become mainstream from a personalized or functional medicine approach. And I just turned 70. This is my natural color of hair. I don't have a lot of wrinkles for my age, etc., because I really personally and professionally participate with personalized or functional medicine. And it looks at the cause of the problem instead of just treating symptoms. It doesn't mean I throw away the baby with the bathwater. Of course, I believe in what you might call traditional medicine. I kind of see this as a current specialty, and we hope it will become more of a broad range approach where all primary care doctors, gynecologists, neurologists, cardiologists, etc., will really want to adapt this approach in their particular specialty, because of course I write prescriptions for medicines. But if you look at the cause of the problem, sometimes you can treat the cause and you don't have to go down the road of a medication. Also, every single prescription causes between 2 and 10 nutritional depletions. And in conventional medicine, we don't look at that. We only look at the idea of, hi, here's your prescription. So let's take myself. I do take bioidentical hormones, which does include estrogen that is compounded and progesterone and DHEA, but estrogen depletes the body of B5 and B6. And that means estrogen of any variety that's prescribed, whether it's oral contraceptives, synthetic hormones, natural hormones. But conventionally, we really don't say to the patient, Please take B vitamins twice a day, but we should so people don't have nutritional depletions. So it's a myriad of things that kind of connects the dots, shall we say.
Thank you. That makes a lot of sense. And that's why I took this clinical mentorship class with you. And also I'm the happy owner of some of your books. And I'm looking forward to your upcoming book about breast cancer. So before I ask you about the book that is due to come out very soon, I want to ask you, what is your main goal when you talk about what should I do as a practitioner on Monday morning? Because your approach is very hands-on, very practical, and that's why it's so helpful to me, especially in difficult cases, such as, let's say, an autoimmune condition or a hormonal imbalance issue. What do you think is crucial for me to do Monday morning in this personalized medicine model?
I'm so glad you asked that, because that's such a pertinent question. So let's take autoimmune diseases, since you asked about that. That's really the body attacking itself. Whether you're talking about thyroid with Hashimoto's or Graves', or you're talking about the colon and looking at Crohn's. When I was in medical school, and granted it's been 50 years, there was only 24 autoimmune diseases. There's now 108, with the 107th being long haul COVID, and long haul Lyme is 108th. So chronic diseases are changing because the body is literally attacking itself, which is an inflammatory process. So on Monday morning, if someone has any of the autoimmune diseases, we always start with one, take the patient off of gluten, because it does seem to be an issue for people with autoimmune diseases. Not everyone, but people with autoimmune diseases. Number two, we do fix the gut. The gut is not normal in people who have an autoimmune disease, and the GI tract is 70% of the immune system. So again, we want to look at the cause of the problem. So we do a functional medicine test of gut health, fix it, and then we decrease the inflammatory component by starting low-dose naltrexone. Naltrexone is what we've always used for drug overdoses, about 150 milligrams, but in low doses, 1, 2, 3, 4.5 milligrams, it very much helps distinguish the autoimmune diseases and really decrease that inflammatory component that occurs with them. And so we are able to go after some of the causes of the problem. Can we reverse all autoimmune diseases? Of course not. Can we reverse a small number? Yes. I used to have Raynaud's. I don't anymore. Some of my patients who've had Hashimoto's early on, we've been able to decrease the titers and actually in some of them cure them of the disease. But with this approach, most people do not progress in their disease process. It does not get worse because we're looking at the cause of the problem.
I asked many doctors about this approach, and many of them are still resistant to prescribing something that is used for drug overuse. So do you have any suggestions for somebody? I know that this is your favorite, the low-dose naltrexone, but is there anything natural that can be used instead of that? Let's say CBD oil, or I don't know, any other suggestions?
Yes, certainly curcumin or turmeric decreases inflammation. Omega-3 fatty acids, otherwise known as fish oil, does. And people really should not be afraid as a patient or as a prescriber to use LDN, because it's been used for 10 years for this purpose, and now it is well documented in the medical literature. The trouble is we all get so busy, we don't have time to read everything in the medical literature. It's part of the reason I started a brand new course in personalized medicine, a certification at the Morsani College of Medicine at the University of South Florida, to help practitioners get retrained in this area. I guess a good approach would say additional training, so that they can add on to whatever their specialty currently is, or family practice or internal medicine.
How can we find this course? And is it in person or is it online?
The first course currently is being run in person only. We ran it in April in Scottsdale and it sold out. So we're running it again in November in St. Petersburg, Florida at the beautiful Don Cesar. People can go to personalizedmedicinecertification.com. So that's personalizedmedicinecertification.com. It talks all about the program. You can even sign up online. You can get the hotel. But the first course is endocrinology. And we really look at prescribing hormones for both men and women, the pros and cons, because it's not for everyone. We look at thyroid disease extensively. We look at a hormone that people don't know much about called pregnenolone, but such an important hormone because it's the hormone of memory. It also decreases inflammation. In fact, estrogen, progesterone, testosterone, DHEA, cortisol, pregnenolone, and melatonin are all anti-inflammatory. So that's on site 24 hours. To complete the certification, you also have webinars and case histories to do. But really, what you do every day on Monday morning is how this course is designed. And it really is very, very practical. Next year will be courses 2 and 3. They will be hybrid courses, so people can join us for course 2 in March, looking at dermatology, autoimmune diseases, infectious disease, and some other specialty areas in Houston, or they can take it online. And then in November, we will be back next year in Scottsdale for course number 3, which again will be hybrid, how to interpret functional medicine labs. We're looking at memory, neurology, psychology, and toxicology. Toxins are becoming more important in today's world, and there's some very new and exciting techniques to get rid of toxins like PCBs in the body that we will be discussing.
This seems very interesting, and I can testify this is a very useful course that, I mean, I took some of your mentorship. I'm sure this is even more interesting and more important to take, but whatever I learned with you so far and from your books changed my practice and personally my life. So I want to spend some time talking about your upcoming book on breast cancer, and I have here I think everyone should read, at least every woman should read your book, What You Must Know About Women's Hormones. I personally use it as a reference book almost every day in my clinic. So I want you to tell me what triggered this idea on breast cancer. I know it's one of the, is it the second most frequent cancer in women these days? After the lung cancer?
Well, really, it's a twofold answer. So I changed fields, and I was perfectly happy being an ER doctor in a level 1 trauma center until I couldn't sleep. And I was fortunate enough to go to a conference and found out that perhaps having low progesterone was the cause of the problem. 11 doctors wanted to give me a sleeping pill. Instead, I did the first saliva test in the Midwest and found out that I happened to be very low in progesterone. It was very fortuitous that I did this because if you're low in progesterone and you have a lot of estrogen, called estrogen dominance, which I was, you have an increased risk in getting breast cancer. I also found out that I had a gene, methyl-tetrahydrofolate reductase SNP, where I have a gene where I don't methylate correctly. So I've been taking methylated B vitamins now for 35 years. So that started me down this journey. I really decided to write the book on breast cancer because I have breast cancer on both sides of my family. And on one side, I never even met a grandmother. I have a cousin. On the other side, I have aunts and cousins that have breast cancer. Plus, it's become more common. When I was in medical school, 1 in 24 women got breast cancer. It is now 1 in 8. It used to be that we saw breast cancer later on. I'm sure you've seen the new study that came out this year that we are seeing cancers like breast and colon in very young women. So in writing this book, my goal is to help prevent breast cancer and for women who've had the disease to also help prevent a reoccurrence.
What is some practical advice that you offer to someone who already has breast cancer? And I know it's not just one type of breast cancer, but let's say an early stage of breast cancer.
An early stage of breast cancer is absolutely to have your hormones measured and see if, depending on your treatment, are you still estrogen dominant? Do you have enough hormones for balance? It is to look at methylation. We can do a simple methylation test. We can measure homocysteine. We can fix methylation defects in every single patient. So we don't even have to have that as an issue. We just really have to be aware that 50% of people don't methylate well, and we can fix the cause of the problem by taking methylated vitamins. There's other things that you can do. We really do believe that most people get cancer, at least the cells, 7 or 8 times in their lifetime. There's 3 things that feed those cells: stress, sugar. I'm still working on chocolate. That's a hard one for me personally. And toxins. And so we do measure cortisol by saliva testing, the stress hormone. We certainly can work with people on their diet and decrease inflammation, because sugar causes inflammation. Breast cancer is inflammatory. And we do have ways now to remove PCBs and really other phytoestrogens, bisphenol A, all the kinds of phytoestrogens or estrogen-like compounds in the body. So there's a number of ways that you can help prevent breast cancer and prevent a reoccurrence in people, because in conventional medicine, the treatments are great. And I do recommend people have conventional treatments if they've had breast cancer, but then usually the oncologists stop and they don't go on to look at the ideas of what can we do to prevent a reoccurrence.
Do you find there is a lot of association between, generally speaking, between hormonal dysregulation and occurrence of cancer?
Yes. In fact, in many women, it starts very young. In women with PMS and PCOS, polycystic ovarian disease, they do have low progesterone. And women with PCOS also have high testosterone. We can diagnose PCOS when someone's 18. She already has an increased risk in becoming diabetic and being overweight. What we don't commonly talk about is an increase in breast cancer, ovarian cancer, and also endometrial or uterine cancer. We know that when she's 18. So we can start even then in helping prevent it. So great things to do on Monday morning. I don't know about you, but every time I talk about that, I get goosebumps, because we can help people even at very young ages.
Can you offer us an example of somebody young that you help?
Absolutely. I have a patient who happens to be a physician, and she has a lot of stress, as most practitioners do. So we worked on her stress. We got her hormones balanced because they were not balanced. But another hormone that wasn't balanced in her was insulin. That's the hormone that regulates blood sugar. And honestly, most patients, unless they see a functional or personalized medicine doctor, never have the hormone measured. But we measured it. Her fasting insulin was very, very high, which meant she was insulin resistant. She would become diabetic. And in helping her eat better, exercise, balancing the hormones, working on insulin, she lost 70 pounds. And she did much better. She felt better. She was able to help her own patients better. And she started dancing. And believe it or not, in the territory and the state she lives in, she went on with all the weight loss and the increase in energy, decreased risk of breast cancer, to win Dancing with the Stars. None of this would have ever happened if she had not gone down the road of looking at hormonal balance.
That's amazing, fascinating work. I wanted to ask you, when you talk about stress regulation, it sounds easy, but in the routines that we all have, especially as doctors, it is not so easy to find the time to set up that time frame to relax. So how do you approach this with somebody who's very busy, who doesn't have time, has some kids at home and a professional life? What do you do first?
Well, first of all, when we look at the idea of exercise, that means that we exercise for memory, etc. But that also means that we do calming exercises, stress reduction techniques like prayer, meditation, Tai Chi, yoga, Qigong, exercise, massage, breathing techniques. If, as a practitioner, you start your day with something calming and on the opposite days, more aggressive exercise, then the day doesn't get away with you. You actually have already done it before it becomes more stressful as the time goes on. A multivitamin is really important because the adrenal glands that make cortisol use nutrients. Adaptogenic herbs like ashwagandha, ginseng, rhodiola, calming herbs are very important as well. And honestly, I really do believe that we can improve cortisol in practitioners, but we probably don't normalize it until they retire because they really are available to their patients. Most practitioners are 24 hours a day, 7 days a week, every day of the year. And because of that, it does make the stress a little more intense, but we can take it down a notch.
Could you please share some of your personal roadblocks or professional roadblocks, some stressful moments of your career or of your personal life? You already mentioned one with your challenge with sleep. And how did you handle this stress and this obstacle?
Well, people have personal stress and they have professional stress. And unfortunately, most practitioners tend to have both. When the personal stress comes its way, you have to realize that God honestly never gives you more stress than you can handle. And at some point, whatever that personal stress may be, whether it's a spouse or a child or taking care of your parents, I took care of both of my parents. And really, I was so thrilled that I had the ability to do that, to help each one of them and throughout their life struggles at the end of their life. So all of those become challenges for practitioners. So what I did when I took care of my mom and dad, I did cut down my hours. I still do stress reduction techniques. I speak at a lot of medical conferences. I will be going to Houston to speak at a conference in October, and I'm going to speak at 2 different compounding pharmacies. I have a day off, and then I'm speaking at the conference. So I'll be in Houston for 6 days. That day off, I'm going to go have a massage and a facial and all those other things. That's just as important as everything else to keep you healthy.
That's so true. So what general advice you would offer to a young doctor?
If you're in a medical school right now, please don't give up. Don't feel like, this is never going to end. I think we all feel that way. Stay on the course. You will end up loving it. It's the best career in the entire world. When you get done, sit down and seriously ask yourself, what specialty area do you want to go into? Because it really does define the rest of your life between the hours that you work and really what kind of patients that you see. If you're like me and you're not good with kids, because when kids die, that really affects me. So I tried when I was an ER doctor not to rotate to children's because it was really, really hard on me and them both. So kind of realize what your own limitations are, what your own talents are, but explore this field of personalized and functional medicine. Whatever you could decide to be, whether you're going to be a dermatologist or oncologist or whatever your field is, there is a personalized functional medicine side to that. Please try and incorporate that into the patient. And remember, when you see them, I always ask one question: what brings you in to see me today? Always make sure you deal with their chief complaint. You may think something else is more important, but to give comfort to the patient is the most important thing. If you help them with their chief complaint, they're much more compliant in other things you want them to do.
Thank you. How would you approach, I know you're not seeing kids as much, but what advice would you offer to a mother that deals with a teenager with ADHD or depression or other psychoneuroimmunological problem?
When you talk about a teenager, the health of the child has to do with the health of the mother. So I always start with the health of the mother. If you have a planned pregnancy, then make sure that you are healthy. We are doing toxin testing now on people who are planning on a pregnancy. If they do have PCBs or lead, mercury, etc., because it is transferred through the placenta and the breast milk, we want to get those out before they get pregnant, because we do know some of those things are related to ADD, ADHD, and neuroinflammation. So the health of the mother is what we start with. When we start looking at the teenager, we are looking more at getting those toxins out of the body. We look at neurotransmitter testing, where we can look at measuring different kinds of neurotransmitters like GABA, serotonin, the happy neurotransmitter, and trying to get those into alignment. I really do believe for someone to be healthy, they have to be physically healthy, emotionally healthy, and spiritually healthy, whatever that may mean for them. And so we want them to look at all components of their life. But I do have some concerns about what happens when people stay on the computer, cell phones, etc. so much, because it is rewiring the brain. We are getting neuroinflammation. It causes insomnia in some patients. So unless I'm on call, honestly, I turn off my cell phone and my computer at 7 p.m. It does help people sleep better. People don't adequately socialize if they stay on the computer all the time and don't really talk to people. It is important to hug other people. I'm enjoying very much doing this podcast today, but it would be great if I could give you a hug. Those kind of things sometimes get forgotten, and we need to reinstitute those back into medicine.
Well, I'll make sure I'll get that hug at the next conference I'll see you.
Perfect.
So how can we find your books, especially the upcoming book on breast cancer?
On Amazon. Okay. So, and I do want to mention my male book. We talked about women's hormones. I did write a book on males. So maximize your male hormones, because if we help her be balanced, we want to help him be balanced. Prostate cancer is on the rise as well, colon cancer in men. So there's a lot to offer now. So Amazon is the easiest and the most cost-effective place to get my books.
Great. Very exciting. I'm looking forward to getting your book on breast cancer. So last question, you are such an inspiration for all of us in this field. And I'm just curious, what do you think is a good life, a life worth living?
Oh, what an interesting question. A life worth living is really one where you can help other people, because it's really not about you. It really is about what you can do to help other people. And when it comes to this functional personalized medicine approach, every patient, we all deserve this kind of healthcare. So if people are a practitioner watching this podcast, I hope they will join me in helping this kind of medicine become the standard of care for all, because all people really do deserve this. Then honestly, that would be the best thing that could ever happen in my life, is to see this kind of medicine progress further.
Thank you so much. I'm so grateful for you taking the time today to be here with us. And I'm looking forward to giving you that hug at the next conference.
I'm looking forward to it as well. And thank you so much for the invitation.
Thank you.